If you've ever felt dizzy or lightheaded, you're not alone. In fact, one of the most common reasons people go to the doctor is for dizziness. There are so many reasons that could make you dizzy. Medications, dehydration, inner ear disturbances, or motion sickness, to name a few. Most of the time it is minor and will resolve on its own. However, in some situations, dizziness can be a sign of something more serious. The specialists at Lake, Ear, Nose, Throat, and Facial Plastic Surgery explain how they search for the underlying causes of dizziness using vestibular testing.
Dizzy is a very broad term, and we often like the primary care doctor to have evaluated the patient from a dizzy standpoint because it can be something cardiac or neurological in origin, and that probably needs to be looked into or ruled out beforehand. But then, you know, the inner ear does make up part of the balance system, but it's not the only piece. It's one of the pieces.
The physician may notice through their evaluation the patient's inability to perform certain exercises or walk properly, and then that would lead to other questions from the physician. Then that's where that would trigger an order for vestibular function testing.
And we've gone on to incorporate a vestibular lab, which kind of treats a dizzy patient. We've taken that audiological services into the vestibular lab and then incorporated ENG testing, which also kind of helps us better diagnose the type of problem with the balance system and equilibrium.
50% of dizziness, people suffering from dizziness, is going to be in an inner ear issue or otologic issue. The way that you treat and fix some inner ear disorders are done through what's called vestibular rehabilitation, and that is a type of physical therapy in order to realign or break up what some people call debris or rocks in the ear. Dizziness for the aging population can be a pretty serious factor when you incorporate fall risk. And you know, if they do have something wrong with them or a inner ear disorder, it's easily treatable, and they don't have to live with a debilitating sickness or dizziness all the time.
For more information on dizziness, as well as links to the specialists at Lake, Ear, Nose, Throat, and Facial Plastic Surgery, please click on the Stop Spinning Story icon on our homepage, yourhometownhealth.com.